Hi all, welcome to the question discussion session. Let's see the first question. A 13 weeks pregnant multigravida woman is anxious and apprehensive. She has 5 children and is not willing to continue with this pregnancy. She is requesting the midwife to abort the fetus. She is underweight, malnutrition, and is overworked. BMI is 17 kg per meter square. What intervention is decided immediately? A. Admission and intravenous line management for induction. B. Family planning and birth control measures. C. Dietary management and supplements. D. Support, reassurance and counseling. So here 13 weeks multigravida woman is presented to the clinic. She has 5 children and she is very anxious. What her complaint is, she is anxious and she is requesting the nurse for abortion. She is malnourished, overworked, and her BMI is 17 and she is underweight, which indicates she is malnourished. So what intervention is decided immediately? Now most of the people confused with the answer here. Most of them might be confused with the option number C, which is dietary management and supplements. But what we have to focus is that the major problem of the client is what? What is her main complaint? She is anxious, and because of that, why she is anxious? She has already 5 children and she don't want to continue with the pregnancy, and that's why she is requesting for abortion. So there are two things. First, she is anxious. Second, she is requesting for abortion. So our focus should be on anxious. If a patient is anxious, we have to reduce her anxiety. So for that, we should give her support, mental support. Okay, and she is requesting for abortion. So that requires what? Proper education, which is also known as counseling. So before taking a decision, before taking such a crucial decision, we might our responsibility is to give her proper education regarding the procedure and or regarding the continuation of pregnancy. Then and we have to assist them to make a decision. So because here the patient is the mother is anxious, and what we have to do is support and reassurance. And as she is requesting the midwife for abortion, she requires counseling. So answer is support, reassurance and counseling. So that is the first important goal. Once she becomes emotionally stable, then only we can give the remaining care such as dietary measurements or IV line and all that. So here the main concern is the mother's anxiety. So we have to support her and reassure her. And as she is requesting for abortion, we have to give her counseling. So answer is option D. Let's check the answer. It's answer D. Support, reassurance and counseling. Next question. A nurse is assessing the uterus of a G5P4 patient immediately after delivery. The nurse notes fundus is not contracted. Which of the following is the most appropriate immediate action should be taken? A. Massage the fundus. B. Assess the bladder. C. Elevate the mother's legs. D. Encourage the mother to void. So here we are assessing the uterus of a G5P4 patient. And what's the finding? Nurse notes the fundus is not contracted. So what we have to remember is that after the delivery also the uterus should remain contracted. Following the placental separation, what happens is that capillaries in the uterine wall get ruptured because of placental separation, and there will be a slight bleeding. So it is important for the uterus to remain contracted so that these capillaries will get closed. So in order to close the capillaries of the uterine wall, the uterus needs to be contracted, and if the uterus cannot contract, the capillaries remain open and it leads to increased bleeding, and it might lead to the risk for postpartum hemorrhage. Okay, so inability of the uterus to contract is known as atonic uterus. So if the uterus is not contracting after delivery, it's known as atonic uterus. Inability of the uterus to contract after the delivery of fetus. It increases the risk of postpartum hemorrhage. So what we have to do is to stimulate the uterus for contraction. So initial action what we do is to massage the fundal area, to massage the fundus. Once we massage the fundus, uterus will get stimulated and it starts contracting. If fundal massage is not successful, next responsibility is to administer oxytocin, the hormone which helps in the uterine contraction. So these are the two management for atonic uterus. First one is fundal massage and second is oxytocin infusion. So here the question is about uterine atony. Fundus is not contracted after delivery. So which of the following is appropriate? First option is to massage the fundus. So answer is option A, massage the fundus. Inability of the uterus to contract is known as atonic uterus. Managements are first is fundal massage and second is oxytocin infusion. Next question, pregnancy patches contraindication. Contraindication for pregnancy patches. A, overweight, above 80 kg or overweight. B, have diarrhea. C, with antibiotics. So what is pregnancy patches? Pregnancy patches are transdermal contraceptive patches which releases hormone through the skin to prevent the pregnancy. So contraceptive patch is a small sticky patch that releases hormones into your body through your skin to prevent pregnancy. So what are the features of the pregnancy patches? If you have heavy painful periods, during painful periods, these pregnancy patches can help. These oral contraceptives or the hormonal action might reduce the pain during the periods. But though it helps during painful periods, it has some side effects also. It can increase your blood pressure and causes side effects like headache. So side effects of contraceptive patches or pregnancy patches are hypertension and headache. One of the use of pregnancy patches is that it helps in treating ovarian cancer and womb cancer and bowel cancer. Okay, just like oral contraceptives, this is also used to treat certain cancers which are ovarian cancer, bowel cancer and uterine cancer. And coming to the point, it may not be suitable for women. Now is the contraindications. It might not be suitable for the women who smoke, who are 35 years or over and who are overweight. So the contraindications of pregnancy patches are women who smokes or age above 35 and who are overweight. So these are the contraindications for pregnancy patches. So now let's see the options again. There are three options given here: overweight, diarrhea and with antibiotics. So just like we discussed, one of the contraindication for pregnancy patches is overweight. Another contraindications are age above 35 and women who smoke. Okay, so here answer is option A, which is overweight. Next question, the pregnant woman is asking the nurse about the function of placenta. The nurse explained to her that placenta provide your baby with food and oxygen. Question is, which another function does placenta have? So in addition to providing food and oxygen to the baby, what is the function of placenta? That is the question. A, cushion and protect the baby. It gives cushion effect and protects the baby. B, produce HCG, human chorionic gonadotropin. C, produce contraction. So in addition to providing oxygen and food to the baby, placenta also produce hormones which is known as HCG or human chorionic gonadotropin. Okay, so answer is option B, it produces HCG. Next question, oral contraceptives increase the risk for which cancer due to long-term using? This is an important question. Oral contraceptives might cause certain cancers, or long-term use of oral contraceptives might lead to certain cancers. The question is, which cancer is that? Option A, stomach cancer. B, ovarian cancer. C, skin cancer. D, breast cancer. So one of the complications of oral contraceptives is it causes cancers like CA breast and CA cervix. So here options are stomach, ovarian, skin and breast cancer. So only option available is option D, breast cancer. Oral contraceptives are used to treat ovarian cancer and endometriosis, especially it reduces the risk for endometriosis. It is also used to treat ovarian cancer, but the complications of oral contraceptives are CA breast and CA cervix. So answer is option D, which is breast cancer. Next question, pregnant mothers in 9 weeks, she came to the ER with vaginal bleeding and lower abdominal cramp. On the US, which is ultrasonography, USG, the concept of products are in the lower uterus? Options are missed abortion, threatened abortion, inevitable abortion, and D, complete abortion. So here the important points are, question is related to abortion. Important points are, one of the point is in USG, the concept of products is in the lower uterus. Let's see about the remaining options. A missed abortion. What is missed abortion? The fetus is dead and remains in the uterus for a viable period. Client might not be able to recognize, fetus might be dead and retained in the uterus for a viable period, which is known as missed abortion. Threatened abortion is borning stage. The abortion has started, but the continuation of pregnancy is still possible. That is known as threatened abortion. For that management of threatened abortion, we give tocolytics to prevent premature labor. So that is threatened abortion. See, inevitable abortion is exact opposite of threatened abortion. It is a stage from which the continuation of pregnancy is not possible. Now coming to fourth option, which is complete abortion. There are two types on the basis of concept of products. On the basis of expulsion of conception, products of conception, which one is known as complete and second is known as incomplete. Incomplete abortion means the contents are not properly expelled out. Some parts will still remain inside the uterine cavity. And in complete abortion, the products of conception will be expelled from the uterus and it might get completely expelled out, or it might remain in the lower segment of the uterus. So here the concept of products is in the lower uterus. That's why it comes under complete abortion. In incomplete abortion, products will not be completely removed from the uterus. Some products will remain inside the uterus. In complete abortion, the contents will be removed from the uterus. It might get completely expelled out, or it can remain in the lower uterine segment. So answer is option D, complete abortion. Next question, the nurse examined pregnant women for the 5 factors affecting labor process. 5 P's: passenger, passage, powers, placenta, and which of the following additional factors? So there are 5 factors which are affecting the labor, which are known as 5 P's: passenger, passage, powers, placenta, and which of the following additional factor? Option A, pathway, B, psychology, C, process, and D, purpose. So the 5 P's which affects labor are, first one is the passenger, which means the baby, and second is the passage or pathway, which is from the uterus to the pelvic canal. So that is the passage. Placenta, third, power means contraction. The force of contraction is known as power. Next is placenta, and the fifth one is psychological state of the mother. So these are the 5 factors: passenger, passage, power, placenta, and psychology of the mother. So here option B is the answer, psychology. Option B, psychology. Next question, what hormone is responsible for, or what are the hormones for biological difference between male and female? In order to detect the biological difference between male and female, what hormones are responsible? Option A, estrogen and HCG, B, testosterone and progesterone, C, estrogen and progesterone, D, estrogen and oxytocin. This is a simple question. In order to determine the biological difference, the hormones which we assess are testosterone and progesterone. Testosterone will be more in males, progesterone will be high in females. So the answer is option B, testosterone and progesterone. Next, in vitro fertilization or vitro fertilization is related to, the question asks for the indications of in vitro fertilization. Let's see the options. A, blockage of fallopian tube, B, donor of the sperm, C, absence of sperm, D, immune allergic hormone. So there is only one option which is positive, and there is only one correct answer for this. One of the indication for in vitro fertilization. What is in vitro fertilization? In vitro fertilization, the fertilization occurs outside the uterine cavity, mainly in a institute like lab. So the fertilization occurs outside uterine cavity is known as in vitro fertilization. Mostly it occurs inside a lab. So one of the indication for in vitro fertilization is blockage of fallopian tube, or it's known as tubal obstruction. So this also is an important question. Indication for in vitro fertilization is blockage of fallopian tube. Answer is A, blockage of fallopian tube. Next question, what is the characteristics of ectopic pregnancy pain? A, abdominal cramp. C, throbbing pain in lower part. C, sudden pain in upper part. So what is ectopic pregnancy? Ectopic pregnancy is the implantation of fertilized ovum outside the uterine cavity. Most common location is fallopian tube. Ampulla of the fallopian tube is the most common location. So the characteristics of ectopic pregnancy is that the patient will have sharp abdominal pain, mostly in the lower abdominal region, and it will radiate to the shoulder. So the answer is throbbing pain in the lower abdomen. It also radiates to the shoulder. The complication of ectopic pregnancy is rupture, and due to rupture, mother might go to hypovolemic shock. So the priority management of ectopic pregnancy is, first initial action is to replace the fluid volume, and another management is surgical procedure, which is removal of fallopian tube, which is known as salpingectomy. And we also give a medication to prevent the cell division of the embryo. The drug name is also important. The drug is methotrexate. Okay. Another management is tubal ligation. So these are the management of ectopic pregnancy. First one is fluid volume expansion. Second is salpingectomy or tubal ligation. And third, we give drug to prevent the cell division, which is methotrexate. So here the question is regarding the ectopic pregnancy pain. So just like I said, there will be sharp pain in the lower abdomen region radiating to the shoulder. So from these options, the right answer is throbbing pain in the lower part. Answer is B, throbbing pain in lower part. Next question, a mother is in the midwife's clinic with the complaint of redness and swelling in her right breast. She is breastfeeding her 9-month-old baby. What should be the immediate intervention? So a mother is complaining of redness and swelling in the right breast, which indicates mastitis. She is breastfeeding her 9-month-old baby. What should be the immediate intervention? A, start on antibiotics. B, detailed investigations. C, stop the breastfeeding. D, wound cleaning and dressing. So one of the important point that you should remember is that the mother with mastitis does not require to stop breastfeeding. She can start antibiotics and continue breastfeeding. Okay, so here the immediate action should be to start the antibiotics, and another point is that she does not need to stop her breastfeeding. So answer is option A, start on antibiotics.